Concepts, but one of the ones that you'll hear about fairly quickly on is this thing called Medicare. So in 15 words or less, can you tell the audience what is Medicare, Seshu?
Now, Medicare is a system funded by the government to provide basic health care to all citizens and permanent residents free of cost. This includes hospital care. So that is what the Medicare is about. And very few countries around the world have this. Canada is one of the others, then Australia, where everything is basically covered by taxpayer money. So Medicare funds that. So, of course, there is a ceiling to what, not for the patients, but for the doctors, right? Mm-hmm. Patients get no ceiling. Everything is, when I say everything is covered, it includes consultations, investigations, and medications. Everything is covered. Mm-hmm. I mean, in a snapshot.
Mm-hmm. Yeah, so it's a universal health insurance program, and it is a very broad program. But access to Medicare can be important for GPs, can't it? It can affect how you practice and where you can practice. Is that right?
Yep, that's right. As an international medical graduate, there were restrictions on how I access Medicare. And one of the restrictions was the moratorium. And I had to pick employment in an area of need. In those days, that's what it was called. Now it is called the distribution priority area. So I had to go there and work for 10 years. But where I was in a 5-year overseas trained doctor program, because that was a town which couldn't get doctors. So I chose that. In 5 years, my moratorium was done, basically. So you got to pick these information and, and work on those and work through them.
Yeah, that's basically what this map explains. Technically, if you went through the process, got your fellowship as a GP, you could set up practice in one of the blue areas, but you wouldn't get a provider number, so no one would come and see you because you'd be charging too much, basically, or you would have to charge so little that it wasn't viable. So that's how the federal government regulates where people can work. One of the interesting parts of it, though, is if you're having to do some work in the hospital system, which does still happen with general practice, it doesn't affect where you can work because the hospital system doesn't run directly off your ability to generate Medicare billings. So hopefully that makes a little bit more sense. So, as I said, you might have heard of this 10-year moratorium, which, as Seshu says, has in various ways been reduced depending on the program you're on to, say, down to 5 years. You might also hear of something called the 19AB restriction. It's basically the same thing.